Did you know that almost half of all tasks that a nurse does involves making clinical decisions? Yet currently less than 1/4 of graduate nurses, all who have passed the NCLEX, are competent in clinical judgment. This is the primary reason that the upcoming next generation NCLEX will emphasize case-based scenarios to evaluate clinical decision-making. To effectively teach clinical judgment, it must first be concisely defined and then understood. Because critical thinking, clinical reasoning, and clinical judgment, those similar cognitive constructs, are not the same thing. Clinical judgment is the nurse's conclusion that recognizes then correctly interprets relevant clinical data to determine the best response. Clinical judgment is an outcome dependent on the nurse's critical thinking and clinical reasoning skills. So now let's define critical thinking and clinical reasoning and see how these are similar yet different ways of thinking to make a correct clinical judgment at the bedside. Critical thinking requires the nurse to think clearly, precisely, and accurately, and to act on what they know and understand and are able to apply to the bedside, not just content that is memorized to pass the next test. Knowledge acquisition that takes place primarily in the classroom is also a distinctive of critical thinking. And understanding pathophysiology is foundational to develop this higher level thinking skill that precedes and comes before clinical judgment. And clinical reasoning is the thinking in action that takes place primarily at the bedside while providing patient care. It's dependent on the ability of the nurse to apply knowledge and reason as a situation changes over time. Evaluating assessment data to determine clinical trends and trajectories and anticipate potential outcomes and potential problems are also essential components of clinical reasoning. So to develop the clinical judgment that your students require for both safe practice and licensure, emphasize understanding of essential content, especially pathophysiology. Practice clinical reasoning by making learning active by applying content taught to the bedside, such as an unfolding case study. But nurse educators must change the way nursing is taught. There is no shortcut or easy way out. To be empowered and confidently develop clinical judgment in your students, I just published a new resource for nurse educators, a faculty guide to develop clinical judgment. Check out the link in this video and obtain your copy today. I also have a free clinical reasoning case study on COVID-19 to download on my website, KeithRN.com. And if you found this content helpful, be sure to subscribe to my YouTube channel, Think Like a Nurse, and don't miss the next video coming shortly in this series that will help you to understand the best frameworks to develop clinical judgment in your curriculum. Thanks for watching.